Welcome to Dementia Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is brain health, presented by Jessica Garrison and sponsored by the Prince George's County government and the Department of Family Services. Good evening, everyone, and welcome to the Dementia Friends of America webinar series. We are so glad you are joining us tonight to learn more about dementia awareness and how we can build a more supportive, informed community. My name is Melba, and I am honored to be here on behalf of Dementia Friends of America and our local DFA Northern Prince George's County initiative. Today's session is part of our ongoing effort to increase understanding, reduce stigma, and provide meaningful resources to individuals, caregivers, and professionals impacted by dementia. Before we begin, I want to share an important opportunity. In partnership with the Alzheimer's Foundation of America, we are offering free, confidential memory screenings for adults who would like to better understand their cognitive health. These screenings are one-on-one, private, informational, a caring first step, not a diagnosis. Screenings are available at 15 Crescent Road, Greenbelt, Maryland, starting Tuesday from 9 a.m. to 2 p.m. To schedule an appointment, please call Caesar at 240-241-0037. Sorry about that. It's 202-891-0871. Early detection and awareness matter, and we encourage you to take advantage of these free service or share it with someone who may benefit. We also invite you to consider becoming a dementia friend. Through a short online training, you can learn how dementia affects daily life, improve communication and support skills, help create a more inclusive and understanding community. It only takes a short time to complete, and you'll receive a certificate upon completion. You can register at dfamerica.org/become a dementia friend. Small actions truly make a big difference. We know dementia impacts not just individuals, but families and caregivers as well. That's why we offer free caregiver support groups, both in person and at the Greenbelt Community Center and virtual via Zoom. These groups provide a welcoming space to connect, share experiences, and receive encouragement. Memory Cafe pre-registration required, a stigma-free environment for individuals with early-stage Alzheimer's disease, mild cognitive impairment, or other dementias, along with their caregivers and loved ones. We are also offering caregiver consultations where you can meet one-on-one with a caregiver specialist for support, guidance, resources, and practical strategies to help you navigate caregiving challenges. If you are free If you are feeling isolated or looking for connection, please reach out. You are not alone. For more information, contact Sharon Johnson at 240-542-2029 or Caesar at 202-891-0871. For tonight's presentation, I will ask that everyone refrain from asking any questions so as to not interrupt the presentation until the end of the presentation when I open the discussion for questions. You are welcome to leave your questions in the chat at any time. Now, let's begin tonight's presentation. Jessica, I will pass it on to you now. Just one moment.
Sure. Thank you, Melba. Hi, everyone, and welcome. Thank you for being here with me this evening. My name is Jessica Garrison. I'm a doctorate of healthcare administration and a master occupational therapist. I've been working in the healthcare industry for about 20 years, and I absolutely love what I do. I'm here to talk to you about brain health. I actually wrote a whole brain health program that I'm going to talk to you more about towards the end of the presentation. But I want to start just about discussing overall brain health. What is brain health? My program focuses on helping patients and their caregivers maintain independence with a personalized approach. But brain health itself, it's influenced by lifestyle and the behaviors throughout our lifestyle And we want to focus especially on the behaviors that reduce our risk of having a cognitive decline. We want to focus on improving our overall mental well-being while enhancing our quality of life. Research shows that adopting healthy habits, even later in life, no matter how old we are, can positively affect our brain, right? Um, Brain health is actually really particularly important for older adults because maintaining a certain level of cognitive function will help you support your independence, your safety, your participation in your community, and help you participate in meaningful activities and improve your overall health. It is also equally valuable for individuals living with neurological disorders, people who've experienced past strokes, people who have Parkinson's disease, dementia, even traumatic brain injuries, and other chronic conditions. Brain health is also important for people who have no comorbidities because it's important for everyone, including myself. We want to keep our brains healthy. Can we go to the next slide? Thank you. So again, what is brain health? It refers to the overall functioning of our brains and how they operate across many different aspects of our life. It includes our cognitive performance, our physical abilities, our mental health, our social interactions, and our overall vitality. And there are a lot of different things that really contribute to our brain health, and they include and that can impact our brain health. They include our age-related changes, injury, disease, different mood disorders, even our diet. What we consume in our bodies every day can have a big factor on our brain health and how we feel. I mean, think about it. You could eat a really good, healthy salad with a nice portion of protein, even some fresh fruit or vegetables, and you feel really good after you eat. You feel a little lightweight, but then you can eat a really like a supersized value meal, Big Mac, and you're going to feel lousy. You're going to feel stuffed. You're going to feel unmotivated. You're not necessarily going to want to get off the couch. So what we even put in our body will directly affect how we feel and how our brain feels. Exercise. Exercise is huge. We're going to talk about it even more in depth, the benefits of exercise with your brain health. But just moving around, especially social engagement. If you take the one person who is socially involved in their community, talks to their neighbors, is aware of what's going on in the world around them, and you talk to the other person who really doesn't like to leave their home and is kind of isolated, you'll get two individuals of the same age with two different, I guess, mental capacities and strengths. And you'll see the difference. Like we need social engagement. We're humans. We thrive through social interaction. We're fortunately enough where we do live in a digital era. We can get social interactions in different formats now. Like we can even do what we're doing now. We're Zooming. I'm talking to you. You can see me, and you didn't even have to leave your home. So we're really lucky that we live in this technological era, no matter how hard it is to keep up with, because I understand. There's so many ways that we can engage in the world around us that are really important, and we're going to delve into them a little bit. So there are several components of brain health: medical management, physical activity, healthy diet, that mental stimulation that I talk about, sleep. Sleep is so important. And I know I look at sleep like a bank sometimes. It comes and goes. There's certain nights where I sleep so well. Like I might get 8 hours, sometimes even 9 hours. I'm like, wow, I actually banked time tonight. And there are other nights where I might only get 6 hours. I'm like, that's okay. I'm pulling from my reserves. But sleep is really important. We also need to rest the body as part of the overall picture of wellness. Social interaction, stress management. There is a lot of different components to brain health. Optimizing our overall brain health will help us improve our memory, our attention, and how we process our thoughts, our executive function. It will help us reduce the risk of dementia or any other cognitive issues. It will improve our mood and also help reduce anxiety. There's so much going on in the world today, and anxiety is really prevalent. And having a healthy brain and participating in these components that I'm talking about right here on the screen will help reduce anxiety. Um, it helps enhance neuroplasticity, and that's the brain's ability to snap back and to remember things and to I look at neuroplasticity like a rubber band, right? It is that's the ability, like when you first learn how to ride a bike, that you kind of never forget how to ride a bike. So having a healthy brain helps keep that intact as well. Um, when you participate in the different areas of brain health, you improve your balance, your mobility, your overall physical performance. A healthy brain helps support your independence, and I think that is one of like the key elements of brain health, and one of the reasons that I wanted to put this program out into the community. It also helps improve your overall communication and your social participation. And at the end of the day, a healthy brain improves your overall quality of life. So we're going to delve a little bit more deeper into the components of brain health. Um, there are 7 key factors that I focus on with brain health. The first one is really physical exercise. Regular physical exercise is the strongest protection of brain health, right? Um, you get When you work out regularly, you get increased blood flow to your brain, and that's really important. You Again, it works with that neuroplasticity. It stimulates that neuroplasticity. It keeps it alive and keeps it functioning and firing. It helps improve your memory and learning, which is all part of that brain firing its neurons. It lowers when you work out or participate in any physical activity. It doesn't really even matter the physical activity. You could be walking your neighborhood, or you could be one of those avid pickleball players. You could be a golfer. You could basketball. Anything that you choose to participate in that increases your heart rate is what we consider physical activity. So for many people, it just might be a walking group, and that's great too. Um, by participating in something like this, you're keeping your brain healthy and you're lowering your risk of stroke. You're reducing your body's inflammation. You're helping to prevent diseases like Alzheimer's, and you're improving your mood and decreasing your overall depression. Um, and you as a person, when you work out, you'll you'll have or participate in exercise, you'll have better balance, you'll have improved endurance. Um, you're of course making your brain healthier, and it also reduces your fall risk. So these are all important reasons to participate in physical exercise. Um, and if you are the loved one of a family member who has a cognitive impairment, getting them to participate in physical exercise will help keep your loved one independent longer. They hopefully would have fewer hospitalizations and increased participation in family activities, because those folks who are mobile can participate more in family activities than those who are less mobile. So there's a lot of family benefits too, like being a caregiver and how you can help your family member participate in physical exercise. Um, and then the benefits directly to a caregiver would be, if your loved one is participating in exercise, they might need less assistance doing certain things. So it's going to reduce your overall caregiver burden, and you'll have greater confidence in your loved one's safety. So physical exercise is a key component of maintaining a healthy brain. And then just as important as physical exercise is cognitive exercises. So I don't know how many of you are on your iPhone or your tablet and then you do like a daily word puzzle, or even if you're playing that mahjong, or like the daily mahjong games or word searches, anything. It doesn't even have to be on your phone or your tablet. You could still do the pen and paper method. That is a form of cognitive exercise. And that is awesome. If you've been doing it, keep doing it because you are increasing your learning skills. You're helping improve your memory. You're helping with your problem solving abilities. And it's actually something that you probably enjoy. So it's becoming a hobby, which is really cool because that can help you later with even some social participation if you find a like-minded community. And the benefits of participating in cognitive exercise, it's going to improve your attention, improve your memory. It's going to help build that cognitive reserve, which is really important. Um, Help delay any kind of dementia symptoms or cognitive impairment. And it's going to help support lifelong learning. I mean, we should all be students for life. It's I feel like we always need to be learning to keep our minds active because when we get into that routine of doing something that we know every day, we kind of become stagnant. We're not stimulating anything new and we're not firing anything new up here. So we kind of always want to be learning. So cognitive exercise is just as important as physical exercise. And cognitive exercise actually has a lot of patient benefits. If you are participating and you're the patient or your loved one is participating in cognitive exercise, you will gain greater confidence. You'll have improved problem solving, better better medication management. Have when you have somebody who's on multiple medications, right? That's hard to manage. That is a cognitive task in itself. Um, I had a good friend whose mother had so many pills and she kept it on her lazy Susan. Everybody knows what a lazy Susan is, right? She kept it on her lazy Susan in the middle of her table and would spin it around. And I didn't know how she knew what she was taking, but she had a system and she had it down. And that within itself, remembering when to take what pill when is truly a cognitive exercise for some folks, especially when they're on multiple medications. Um, it will also help improve your overall safety because, again, you have that forethought to realize if something's safe or unsafe, or predict if something could be safe or unsafe. And if your loved one who may have a cognitive impairment or dementia, if they're participating in cognitive exercises, that will improve their communication. Um, because communication can be challenging with people who do have cognitive issues. So just participating in a cognitive exercise will help improve their communication. Um, and it should also be help with meaningful interactions. If it's something that they enjoy doing, it gives the caregiver an opportunity to come in and participate in what they're doing. So it helps bond that caregiver and that person together. So no matter what, if you are the person who suffers from a cognitive issue or your loved one does, cognitive exercise, same as physical exercise, can be something to bond over. And it's really important to participate in. And at the end of the day, you're both improving your brain health and facilitating wellness. And I think that that's a very important aspect. The third aspect of brain health is actually like a centered breathing and stress management. Because, I mean, look at the world we live in today. There is a lot of stressful things going on. And all of us need to learn how to, whether it's family, whether it's political, whether it's financial, whatever it is that's going on that's creating a lot of stress because there's a lot of changes going on in our world, being able to get centered and practice breathing techniques is super important, and managing your stress. So just participating in something as simple as that will help reduce your overall spikes in your cortisol levels. It will help with your attention and your focus. It'll help you with your emotional balance. It'll help with your brain activity and synchronizing your brain activity also to be balanced. Again, if you learn breathing techniques and relaxation techniques, it helps with your oxygen delivery to your brain. Again, all which is beneficial to your brain. So there's different examples. There's diaphragmatic breathing where you like literally just, I'm sorry, I'm gonna stand up so you can see me. Right here is your diaphragm. When you hold in, you want to close that muscle and tense that muscle up and breathe in and breathe out and have it all come from the diaphragm, and you do it slowly in for like 10 seconds, out for 10 seconds, or as long as you can. And if you do that like 3 or 4 times, watch how the pace of everything around you just slows down, because you're slowing this down. You're slowing your mind down. There's alternate nostril breathing where you breathe, like you hold one side and breathe in and breathe out, or you can go in one side and out the other, because it gives you a rhythm. And when you incorporate rhythm into something such as simple as breathing, you're now focused on it and you're concentrated on it, and it relaxes all the other symptoms and systems in your body. So something as simple as being aware of how you breathe and practicing mindful breathing and slowing the world down around you will also improve how your brain functions and help keep your brain healthy. Um, if anything, besides exercise, which is really important, and then we have your cognitive exercise, mindful breathing is right up there, which is as important. At the end of the day, even if you say it, if you're spiritual or religious and you do mindful breathing right around the time of prayer, or you do mindful breathing when you wake up in the morning, just to reset your body, take a moment for yourself and just focus on your breathing at the end of the day. Slow the whole world around, because you deserve it. And if you are the caregiver of somebody who has a cognitive issue, help them participate in it too. Help teach them. Let them do it with you or alongside of you. Help slow both of your worlds down if you can. Um, it's I think it's a really important element. I think when we participate in something such as mindful breathing, or slowing our breathing down, we have a better sense of our own emotional control. Again, reduce anxiety. We improve our overall sleep quality. It improves our concentration. Um, so I'm a huge component of these things. And I also want to say, it's when I put these 7 components, we're only on 3, but when I put these 7 components of brain health together, I really wanted to come at a medical approach, but not treating an illness, treating from a stance of wellness. Because I feel like our healthcare system treats a lot of with medications which are very much needed. Trust me, I've been in healthcare for 20 years, but I believe that we also need to embrace wellness. And how can we stay well? Let's look at the things that we can do to be well, and not necessarily just try to do these things when we're unwell or we're sick, if that makes sense. Um, so this is why this program is really important to me. So far, we have physical exercise, cognitive exercise, centered breathing and stress management. Kind of, we'll put those together. And then we have healthy nutrition. Because again, going back to what I said in the beginning, what we put inside our body truly matters. I use the example of a salad to a supersized value meal at McDonald's. Which one's going to make you feel better, after you eat? Because, we all like a good French fry. But after you eat, which one is going to make you feel better? Which one's long-lasting effects will have you sitting there in the evening and you're like, oh, I feel like I could go out and I could take a walk now, or I'm satisfied. Or the one that's going to make you, give you a little indigestion, not want to get off the couch. You can tell when you eat things that are good for you compared to when you eat things that aren't. So nutrition overall provides the building blocks for your overall optimal brain health. Essentially, it sets the foundation. Okay. Um, there's a lot of different foods that support your brain health. Let's look at our leafy green vegetables, our berries, strawberries, blueberries, blackberries, raspberries. Your berries are all great. Fatty fish. And when I say fatty fish, I'm talking about like your salmon, your anchovies, your cod. There's really good fish that are high in omega-3s, nuts and seeds, whole grains, olive oil, beans. I think like the bean is underestimated. There's so many things you can do with beans, and there's so many different types of beans. Um, Lean proteins, you know, they all help support a healthy brain. Um, but it's important, just as important to know too, what foods don't. So you want to limit like your processed foods, any foods with like an excess amount of sugar, any foods with trans fats, any foods that are high in sodium, um, pardon me, excess alcohol. Excess alcohol is not good for your brain. And you kind of see why. You see what happens to your brain if you have too much alcohol. So excess alcohol is not good for your brain. But if you maintain healthy nutrition, there are a lot of benefits. You're supporting all those little neurotransmitters that are firing in your brain. You're reducing inflammation. You're improving your overall vascular flow. You are supporting that gut brain axis. So by having, like, there's been a lot of research over the last several years about having a healthy gut leads to a healthy mind, right? So you're supporting that gut brain axis by eating healthy. And those foods that I said to omit, when you eliminate those, again, you're only strengthening that gut brain axis. Um, the other benefits are it would increase your memory and it lowers your overall risk for dementia. So that's pretty good reasons to participate in a healthy diet. Um, you'll see improved energy, better concentration, um, a better mood, and an overall better quality of life and better health. Again, all excellent reasons to eat healthy. Um, so, and as a caregiver, better nutrition can reduce complications and even behavioral challenges. It can. Not that it will, but it can. It can help. Um, and it can support overall better health for your loved one as well if you are the caregiver of somebody who has a cognitive issue. And if you notice when I talk about brain health, I talk about that person who may have a cognitive issue, but I also talk about those caregivers of those people too, because both of these people are equally important in having a healthy brain health. Both need to maintain healthy brain health. So a lot of what I talk about the person who may have cognitive impairments, and I talk about their loved ones as well, because I think we need to treat both people the same way and make sure that they're both healthy. Um, so again, rewinding again, we have physical exercise, cognitive exercise, we have that stress management and centered breathing, and then we have a healthy diet. So next up is our social engagement. And I kind of gave us a comparison when we started about social engagement. You have that person who participates in life, that person who knows what's going on in the world. They know what's going on in their community, the doors out from outside their front doors. And then you have the person who doesn't. One of them definitely has a better quality of life and they're helping to maintain their cognitive status and keeping their brain healthier. Social engagement is really important for everyone because as human beings, we are socially charged people. Meaningful social interaction is essential for cognitive and emotional well-being, like family visits, group therapy, volunteer opportunities. There's so many ways to participate in social engagement. Religious participation, Community events, clubs, video calls like we're doing right now. Because like I said, we live in a technological world where this format is now available to us. And this wasn't available 20 years ago. So we need to take advantage of opportunities like this to help maintain our social engagement. By doing so, we build this great cognitive reserve that keeps us in the know. We decrease our isolation, we reduce depression, we lower our dementia risk, we improve our emotional well being, and it helps enhance our overall motivation. Um, Social engagement is really key for everyone. Um, we will see increased happiness, greater purpose in our day to day life, better cognitive stimulation. And again, with a good social engagement, it helps improve our relationships. And our relationships are the foundation sometimes of who we are and who we become. So it's really important to maintain those relationships and continue to improve them. Um, and as a caregiver, if you're participating in these or your loved one is, you all will have reduced loneliness and isolation. Have the ability to share your experience with other caregivers, and just I think greater overall participation in the community around you, because whether you are that person who has a cognitive impairment or a slight cognitive decline or a caregiver, you're not alone. There are so many people like you, no matter where you are in this, that are going through the same thing you are. So social engagement is key. Um, that was number 5. So number 6, I touched on a little bit earlier as well, is that good restorative sleep. We all need a good night's sleep. Um, I've been struggling with my own sleep lately, so I'm one to talk. But I mean, sleep is elemental. We all need it. A good quality sleep allows that brain to slow down and repair itself. It will consolidate your memories and move them to other places in your brain. It helps get rid of all that like metabolic waste that's sitting up here, and it all flushes it out so you can be ready for the next day tomorrow. Sleep is so vital. A good night's sleep, a restorative sleep, will improve your memory, improve your learning, enhance your intention, reduce your fatigue, reduce irritability, improve your mood, and promote your overall brain recovery for the next day. You know, anybody with a good night's sleep, if you see them, they're more alert the next day. They have better participation in the world around them and the community around them the next day. And they're even sharper. Their cognitive performance is even stronger. They might get that joke before everyone else in the room that somebody told. You can always tell when somebody's had like a really good night's sleep. They've got that sassiness. They've got like a snap to them. And it's beautiful. It's great. If you got a good night's sleep. I'm jealous. Um, so it's good to practice a really good sleep routine at home. Um, a good sleep routine would be something like limiting your screen time, limiting, including your phone, your laptop, maybe even the TV before bed, reducing some noise, practicing some mindful breathing that we talked about, some relaxation, maybe even having when you shut your eyes, taking 5 minutes just to go over your gratitude in your mind and to yourself or out loud, however you like. It's your world. Say the things that you're grateful for, a moment of gratitude. So, like getting into a routine that will promote peace and help you sleep will help set you up for a better tomorrow. So, restorative sleep is number 6. And then number 7 is purpose, mindfulness, and emotional well-being, right? It all leads up to that, right? This is where we want to be. But it's like having a purpose, having optimism, and an emotional resilience. It contributes to your long-term brain health, right? That person who is optimistic, that person who is always trying to see that glass half full instead of half empty, tends to have an overall healthier aspect of the world around them. Their happiness tends to resonate, and they don't focus on the negative, making them emotionally more well, I guess, for lack of a better term, than that person who doesn't see that glass half full. Um, you know, these, so to get that mindfulness, you can do, like I said earlier, that moment of gratitude, focus on your spirituality. Um, what it is about your spirituality, what anchors you in, what anchors your soul in, your heart in, your mind in, connect it all together. Meditation. Some people do it through acts of service, like volunteering. Um, you know, you can even do goal setting, like things that are going to make you more positive for tomorrow, um, that are going to push you forward. So like, and your goals don't have to be these great goals. Like I'm going to hike. I see it in my background. I have the mountains today. Like I'm going to hike Mount Everest. No, it can be as simple as saying, I'm going to identify 3 reasons why I'm grateful today. Your goals don't have to be these huge things. They can be something meaningful to you. Um, it's just, even goal setting is a way to practice mindfulness. Participating in meaningful hobbies. If there's something to you that you like to do to keep your hands busy and your mind busy, and it makes you feel good, that is another way to be kind of in the moment. When you do things like this, you reduce your stress, you improve your resilience, um, you enhance your motivation, you improve your overall mental health, and you, in return, it gives you a healthy aspect on aging, which is really important. It's greater life satisfaction and better coping skills, um, and increased motivation. It's all these things put together lead you to a really healthy brain. So again, we have physical exercise, cognitive exercise, mindful breathing, healthy diet, sleep and rest. Um, and then we have, you know, the purposefulness, mindfulness, and emotional well being and stress management. There's all these different components to the 7 areas of brain health that really help you as a caregiver or a person with a cognitive decline help maintain that healthy brain. So, kind of getting a little back into my program, what I did is I created an outpatient rehabilitation program that focuses on brain health and focuses on these 7 areas of brain health. But it's not just for that person who suffers from a cognitive impairment or dementia. It's for that person and their caregiver, because I feel like both are equally important. I feel like if I worked with someone who had a cognitive impairment or mild cognitive impairment or dementia, and I didn't attend to the caregiver, then I was setting my patient up for failure. I feel like both components are equally important. So we build like this collaborative approach to an outpatient therapy program. Um, so right here, the collaborative approach is, so I work for Future Care, and our rehab company is called Vital Strong. So the Vital Strong Brain Health Program takes essentially a comprehensive patient and caregiver centered approach to supporting cognitive and emotional well being through evidence based therapies. Many people go to therapy when something's wrong. Um, this is really a program that's focused on wellness. So we work really closely with the patients and the caregivers and their families and healthcare providers to create personalized treatment plans based upon what your world looks like, about what's going on in your home, or what's going on with you as the caregiver, the patient who's suffering from any kind of cognitive impairment. We have a goal of facilitating your independence and enhancing the overall quality of life in your everyday activities, whether that is teaching that person with a cognitive impairment how to manage different symptoms of their cognitive impairment, or to talk to the caregiver about how to help the person with a cognitive impairment manage, and also talk to the caregiver about how to manage their own stress that comes along with being a caregiver. So it's a comprehensive program. Let me go on to the next slide. So we have several different therapies available. So I am an occupational therapist. The role of occupational therapy, we don't find people jobs. People ask me that all the time. Our role is to focus on the person's remaining abilities, adapt the environment, and provide support to both the individuals with dementia and their caregivers. Occupational therapists play a crucial role in enhancing the quality of life for those who are affected with any kind of cognitive impairment or dementia. Um, we help build up your strength and teach you ways to adapt and live in the world that is around you. And then we work also with we go on the next line, with our speech therapist. Our speech therapists work heavily in cognitive practice, and they can evaluate, diagnose, and treat cognitive communication and swallowing disorders. They also offer personalized strategies to help individuals maintain their independence, improve their quality of life, pardon me, and in addition, they provide guidance to caregivers on how to manage cognitive communication strategies and challenges at home that are associated with dementia or dementia-related symptoms. So with our speech therapist and our occupational therapist together, we will go into all these different 7 aspects of your brain health and come up with a program for not only you, if you have a cognitive impairment or dementia, but also your caregiver. So one of the things that we did do to make this program stronger is that we got our therapists certified, and they are all BCAT certified clinicians. And this is just a specialized tool that delves really deep into different areas of cognitive assessments. So we're able to see what cognitive area that may be affected. Is it your short-term memory or long-term memory? Is it your attention? Is it your executive function? So is it your mood? Is it your practical judgment? There's so many different areas, and people who have cognitive impairments are all affected differently. Some may only have one, some may have several. But we're able to provide a test to see what areas are impaired and then come up with a treatment plan to address those areas in particular. So it's really something unique that we did with all of our therapists. And again, it's an outpatient program. So the structure of our brain health program really essentially is to provide a comprehensive assessment of cognitive function, daily living, and emotional wellness. And we want, again, like I said, educate the patient and the caregiver to impairments and collaborate with the patient and the caregiver for their functional goals. Like, why are we here? What are we working on? Because we need to know what your goals are as well. So we can achieve these goals together. So we'll work with both the patient and the caregiver together. We'll work with you separately. Overall, it's just about improving your brain health. So we will also assist in connecting patients and families to community resources, and provide opportunities for future check-ins. So like, as we know, especially if you're somebody with a cognitive impairment or dementia, it changes over time. So let's say you complete the program one day, we might follow up 3 months later just to see how you're doing. And we can provide another assessment if needed. But yeah, we do check-ins too. And we want to make sure that everybody's well and maintaining a healthy brain. So if this is a program that somebody wants to participate in, it would require a referral from a physician. And then you would have an initial evaluation by either OT, speech, or both. You would have a goal setting session. And then our therapy sessions are 1 to 2 times a week for 4 to 6 weeks. And then we have check-in sessions 1 to 2 times a month after the program's completed. So whether you choose to do something like this, or you just take the nuggets of knowledge that I've provided tonight and look at those 7 areas and just start incorporating them, or even just one. If it's just walking around the block tomorrow, well, two, do walk around the block and focus on some centered breathing. You don't have to come to this program to get the benefits. I've told you what the 7 areas are. I mean, I just want to see everybody living a brain health and well life. But yeah, there's resources out there to help everyone. So why? Why brain health? Why our program? Because caregiving is challenging. Caregiving is emotionally and physically challenging. Caregivers need access to support and resources, and they also need to care for themselves. Um, I believe that by investing in caregiver support, it helps our communities, it helps our loved ones, and you know, overall, it helps us all maintain a sense of well-being. Like, I mean, I think investing in our community is good for everyone. It's good for all of our well-being. It's brain health itself. It's not a single intervention. It's a comprehensive, interdisciplinary approach that integrates those 7 components: the physical activity, cognitive stimulation, nutrition, breathing, sleep, social engagement, and emotional wellness into everyday care. Um, all of these play a really vital role in creating healthy behaviors, and which makes it an important program to me. Um, for patients, this approach improves functional independence. It helps with cognition, emotional well-being, and your overall quality of life. For families, a program like this, or even just focusing on these 7 areas, it offers reassurance, greater participation, a sense of connectedness when you can work with your loved one and you have a similar goal. Um, by incorporating these 7 different pillars that I've discussed multiple times, you know, it helps to it helps to improve our daily routines and, again, helps people age in place and gives the support to our communities that they need. So that's kind of why it's important to me. So caregiver support benefits, again, I guess I got ahead of myself, enhances care quality, resulting in better patient care, offers education and training in effective caregiving techniques and communication strategies, creates a space to ask questions, encourages attention to personal well-being and self-care, and promotes patience and understanding towards our loved ones. Because again, the caregiver is just as important as the patient. So if this was a program that you're interested in, we do it on an outpatient basis. It's covered by insurance. These are the insurances we accept. And we just need a referral from your physician. This is an example of a referral. But I'd be really great to, and again, I'm Jessica Garrison, but I think we've got like 10 minutes left. It'd be a great time to probably open it up to questions if anybody has questions. Oh, and we have facilities all throughout the state of Maryland. So
Well, thank you again for being here to everyone that joined tonight and for taking time to learn more about dementia awareness. A huge thanks to Jessica for taking the time to share your knowledge and experience. We truly appreciate the work that you do to improve dementia awareness. Together, through education, compassion, and community action, we can create a more informed and supportive environment for everyone impacted by dementia. If you missed a previous session, don't worry. All past webinars are available on our YouTube channel. We encourage you to subscribe so you can never miss future presentations. Your voice matters. We invite you to please complete our short feedback form. So let us know about any topics you would like covered, speakers you would like to hear from next, or suggestions for future programs. And that is our presentation for today. Thank you, Jessica.
thank you. Thank you to everyone.